Okay. So if you turn that so I can see
Oh,
it,
sorry.
and then then you can be ready to flip pages when we've done everything.
Okay.
You're the page flipper.
Okay.
You're so good at it. I'm sure you will be.
Somebody's gotta have a talent.
Somebody's got to have a talent. Everybody's got to have a talent.
Oh,
There you
okay.
go.
Well, good to know it's mine.
Okay, so we'll start with the external features, just making sure that you know where everything is. And I'll try and make sure that I'm telling you how the question will be phrased so that you'll get that as well. So, body regions, okay, we'll start out with region, name the region, okay? So this would be axilla. Name this region would be inguinal. Name that region would be the perineum. So make sure that you understand what I'm asking for when I'm saying region, okay? This region is the manus, okay, on the top of the paw, front paw. This region is the pes. This region between pin A and pin B, or whatever letters, would be the antebrachium, and the region between pin A and pin B. So in this case, I'm asking for the region between this pin and this pin, or I could do it on this side, between this pin and this pin is the brachium. Okay? So if it's on this side and I'm saying between this pin and this pin, don't be saying axilla. This region here is the brachium. Okay? Same thing on the hind leg. The region between this pin and this pin would be the thigh, and between this pin and this pin would be the shank. On the head, okay, region, since I'm on a roll here, name this region would be the medial canthus of the eye, the lateral canthus of the eye. So the pin's going to be in the corner of the eye. And if you want clarification, it'll be, this region here, and I'll sort of circle it a little bit if you want, okay? Name this, I think I say structure, the planum nasale in the meat of the nose, as opposed to the pin is inserted into what opening would be the external nares. Okay, so name the structure, name the opening. With a cat, I think we've got at least one or two cats that have their mouths open a little bit, so that I could do the hard palate. Okay, I could do, well, the tongue is sticking out on most of them. Name this structure, spell it right. And potentially, again, if the mouth is open wide enough, the lingual frenulum. Okay, could be a potential question. Couldn't use this cat for it, but. And what tissue is the tongue composed of? Skeletal muscle. For the ear, the pinna would be the flap, and I'd have it, the pin would be like quite obviously in the flap, as opposed to the conchal cartilage, which would be further down. That's what attaches the ear to the head. I could do that like on the outside fur, or, well, not on this one, internally underneath here. So name this structure. So you want to make sure I'm not asking for the parotid salivary gland. So if you want clarification, I would be able to say, well, it's not this part, it's, that part. Okay, so you'll understand I'm talking about the ear. For the parotid salivary gland, it's still named this structure. Okay, so it would be this one as opposed to this one, which isn't dug out. So the parotid or the mandibular salivary gland. Okay, so the parotid is nice on most of the cats. So it's this one, not this one, or this one, not that one, so that you can see it's different glands. And while I'm there, the mandibular lymph nodes are on either side in virtually all the cats I've seen ever. Mandibular lymph nodes are on either side of the anterior facial vein. Okay, so, and it again, name this structure. So the lymph nodes are up here, the salivary glands are down here. Remember, I could say, so name this structure or this structure, so the parotid or the mandibular salivary gland. What is the function of this structure? To produce saliva. And name 2 or 3 other structures with the same function. So you have to know the names of other salivary glands. So sublingual, labial, buccal, zygomatic. Okay, there's a number. Okay. All right. So then okay, let's make sure I'm not missing anything. Oh, the third eyelid, what is the scientific name of this structure? Nictitating membrane. So in that case, I'm not asking for the region, I'm asking for the structure. Okay, nictitating membrane. Scientific name for these structures, vibrissae. Third eyelid, lateral medial canthus. Oh, and the eyelids. So you have scientific name for this structure is the upper palpebrum, and the scientific name for the lower lid is the lower palpebrum. Okay, and what tissue lines this structure would be conjunctiva. Okay. Then I did manus, brachium, antebrachium. Oh yeah, and the tori then. The carpal torus is more lateral. The digital torus number 1 is the dew claw, and it's medial. So don't get, this is not the dew claw. This is the carpal torus. The dew claw torus is over here. So this would be digital torus number 1. This is the carpal torus. Metacarpal torus, and then digital torus number 2, 3, 4, 5. So it's the same as the phalanges. Number 5 is always lateral. Okay, number 1 is medial on the front leg because it's the dew claw. Okay, so the digital tori. Okay. And then the same thing on the hind leg. I already did the thigh and the shank, but there is no such thing as a tarsal torus. This is metatarsal. So remember again for the bones as well, don't forget your bones, is the metacarpals on the front leg, metatarsals on the hind leg. So this would be the metatarsal torus, and then digital tori 2, 3, 4, 5 because they don't have a medial, or they don't have a hind dew claw. And so 5 is always lateral. 5, 4, 3, 2, and then there is no 1. Okay. Nothing there. Okay, so now your muscles of mastication. So people have often said, well, how do I know if you're asking the parotid salivary gland as opposed to the masseter muscle? Well, because I'm going to say name this muscle. So if I don't say name this muscle, then it's, and besides, the parotid salivary gland is back behind by the ear there. So name this muscle, the masseter muscle. What is the action of this muscle? To close the jaw. Don't say to chew or anything like that. It's to close the jaw specifically. Name another muscle with the same action. Temporalis. Okay, so that's how I can ask that question. Then the muscle that opens the jaw is the digastric on the inside of the mandible. Then the sternohyoid runs straight up and down from the mandibular symphysis all the way down to the manubrium, actually. Goes all the way down there. So I'll probably pin it somewhere in here. Okay. And then the sternomastoid is attaching also at the manubrium, but it goes out to the side. So for clarification, sternomastoid, sternohyoid, digastric. So if you know sort of the orientation of them, you'll be fine. The blood vessels here that you need to know, the external jugular vein. The question is, name this blood vessel. So here's your external jugular vein, which splits to form the posterior facial vein going towards the back of the face, the anterior facial vein going towards the front of the face, and the transverse jugular vein connecting the two. Everything is bilateral except for the transverse. It's connecting the two, but you've got the same thing on both sides. You don't ever have to say right and left unless I ask for it, which I don't think I hardly ever do. Okay. The other blood vessel that's in the neck that you need to know is the common carotid artery. So remember, arteries are red, veins are blue, and the question that goes along with the common carotid artery is name another blood vessel that runs in the same sheath, and that would be your internal jugular vein. So make sure that you're staying external for the superficial one, because the, oops, come back here. Ah, the carotid artery just disappeared into the neck. Oh well, I would find one on the other side. But anyways, the common carotid artery runs in the same sheath as the internal jugular vein and three nerves: the vagus, the sympathetic trunk, and the recurrent laryngeal. I could ask for all three, or just two, or maybe even just one, if I'm feeling particularly kind. Okay. Good. Did that. The other question that I could ask is name or tell me what blood vessel is normally used for phlebotomy in a dog. Cephalic? In a horse? External jugular. Cat? Either. Usually it's the external jugular, but it could be the cephalic. Pig? Anterior vena cava. Okay, so that's a possible question. Good. 21 and 20, or 20 and 21, 22. Okay. So the neck muscles, again, we've already done the sternohyoid. Oh, I know what I forgot. I missed it some. Oh no, it's right here. It's coming up. The sternohyoid and the sternomastoid. So again, sternohyoid, like the bars of an H, sternomastoid, like this at the caudal end of the neck. Cleidocephalicus, I would, for demonstration of that, there is a faint aponeurosis that's not real visible on this cat, but about the level of the clavicle. So cleidobrachialis onto the brachium and cleidocephalicus up onto the head. So that, and I would try and pull some of this. When you get to the test, you might find some of your cats have been cleaned up a little bit more than you did, just so we can make this demonstratable more easily. I'm trying to make this grammar sound good. Okay, so there's your cleidocephalicus. So again, I would do it's this one, not this one. Okay, so to help you remember that. And the cleidobrachialis is very superficial. Try and do this in order. The pectoral muscle group, you have the three that you need to know. And again, if you know them in order, the most cranial one is the descending superficial pectoral. Then the next one is the transverse superficial pectoral. And then the final one is the deep pectoral. So pin in here and you're going, I can't see where it's pointing at. I'm not sure. Ask, please ask. It's this one, not this one or this one, or it's this one, not this one or this one, so that if you know them in order, you've got it. You just have to know the names. Okay? Your obliques, the external oblique is the most external. Okay, it's the most superficial. People have in the past gotten it mixed up with the latissimus dorsi. So just be careful. Just be careful that your, remember your latissimus dorsi is up on the thorax and runs up underneath the arm. The external oblique is abdominal. So just keep that in mind. Don't get those mixed up. So there's 4 of them. The external oblique, underneath of which is the internal oblique, and the aponeurosis there, or where the aponeurosis starts there, is a line. So I would show you the line, internal oblique. So it's external oblique, internal oblique, transverse abdominis up to the edge of the rectus abdominis. So the 2 rectus abdomini, is that rectus abdominis? Whatever, join it at the linea alba, which potentially is pinnable, the aponeurosis there. And then the rectus abdominis, I will do this. It's rectus abdominis. It's this one. It's going all the way from the xiphoid down to the pelvis here. Okay, so the rectus abdominis. Then the next one lateral that you can see is the transverse abdominis, and it does run underneath the internal oblique, and there's the external oblique. So the external oblique is pretty much the only one that's lifted up, and then internal oblique, transverse abdominis, and rectus abdominis. Okay, so again, if you know your order, you're good to go. Back up to the head. Poor ordering here. Back up to the head for the trachea versus the larynx. So in order to see the trachea, we've separated the sternohyoid muscles so that you can see the trachea with its rings. There is no possible way for me to say tracheal rings. You'd just be able to see the rings of the trachea. Name this structure. Trachea. More cranial end of the trachea is the larynx, which is the expanded part there. If you're not sure whether I'm pointing at the larynx or the trachea, I can say, well, it's this, not this part. You know, so you can see the more caudal part is the trachea, the more cranial part is the larynx. What is the function of the larynx? What is the function of this structure? Sound production. Okay, don't say voice box. Cats don't have a voice. Meow box? No, don't say meow box either. What's the function is sound production. Okay, and what's the function of this structure? The trachea? Yeah, no, that's too general. Carries air to the lungs. That would be good, because breathing is the whole act of, okay? Okay. Oh, and the thyroid gland, this cat does have it also, because we didn't find this on any of your cats, but right beside the trachea, can you, I don't know if you can get in there and see this. I know what I'm looking at. There's a structure that's beside the trachea, just below the larynx. That's the thyroid gland. It's on either side. If any of you want this pointed out before you leave, but name this structure, and if it's beside the trachea, it's not this, it's this structure here, that would be the thyroid gland. Okay? Not doing the prescapular lymph node. Good. Good. Okay. So our trapezius muscles on the back, you have a trapezius cervical part superficially on top of the scapula, and a trapezius, not picked off, trapezius thoracic part, which is a triangle that sits on top of the latissimus dorsi. So if I was going to do it on this cat, I would lift this up. Okay, so you guys might want to just pick that off so that it's lifted up. But on a test, I would make sure, oh, well, I've done it for you now. There you go. It's lifting off nice. Sometimes it's difficult. Okay, so here's your latissimus dorsi. Your trapezius thoracic part is this triangle that attaches to the dorsal spines of the vertebrae, thoracic vertebrae there, okay, and trapezius cervical part. So those are your two trapezius muscles. Lat dorsi I already did. Lat dorsi is not an acceptable answer. Latissimus dorsi. Rhomboideus, the muscles in between the scapulae, and if so, in get rid of the fur. So I'd have him sort of in a praying position here, and here's the rhomboideus muscles. And oftentimes, if I'm doing rhomboideus and I've got him in this position, I can also do the subscapularis underneath the scapula. Another potential thing I could do is put a sticker on these fossa on the skeleton and say what muscle sits in here, okay, because it's the same basic thing. Okay, the pectorals, and with the pectorals, ventrally, serratus ventralis is deep, and it holds the scapula on to the body. It's not its action. Action is what it does when it contracts, but it holds the scapula onto the body ventrally. So serratus ventralis, okay, next to the pectorals, underneath the latissimus dorsi there. Supraspinatus and infraspinatus. Supraspinatus is underneath the trapezius cervical part. So trapezius cervical part, supraspinatus. I would never take off the trapezius cervical to try and trick you. I'm not out to try and trick you. Believe it or not, I want you to pass. So that will always be there. Okay. Then the infraspinatus. There's the spine of the scapula. The infraspinatus always will be demonstrated with the lat dorsi pulled out of the way so you can see this, the infraspinatus in the infraspinous fossa. And on the bottom border of the scapula, I would separate the teres major. So the teres major is this one on the bottom border. So it's not this one here. It's this one here, and the lat dorsi has to be pulled right out of the way for you to see the teres major. Okay. Your deltoids. Okay, so back up just a little bit. Remember, this one here is your cleidobrachialis. Underneath the cleidobrachialis, way deep to it. Way deep to the cleidobrachialis is the biceps brachii. So it's right underneath it. So beside the cleidobrachialis would be your acromiodeltoid. So it's attaching to the chromion of the spine of the scapula here. So there's the acromiodeltoid. Usually you describe it as a teardrop shape, so it's that one. Acromiodeltoid, as opposed to the spinodeltoid. Spino, because it's attaching to the spine of the scapula. Spinodeltoid is this guy, kind of this, almost a rectangular shape, this guy here. So acromiodeltoid, spinodeltoid. Your biceps brachii, as I said, underneath the cleidobrachialis. And then your triceps brachii is the group, the extensors of the antebrachium, or extensors of the elbow, whatever. That's the longest answer you're going to have to give. Name this muscle: triceps brachii lateral head on the lateral side. Triceps brachii medial head is underneath the lateral, and triceps brachii long head is the biggest one, the great big guy that's running down the back here. They all three attach to the olecranon, but this one's been detached so that we can see the medial head. Digital, pardon me, digital extensor group on the top of the arm, digital flexor group on the bottom. So name this muscle group. Oh, I know what I forgot to do this morning. Name this muscle group. Name this muscle group. Digital flexors, digital extensors. Okay. Oh, and just while I think of it, the veins, blood vessel on the forelimb, brachial vein on the brachium, and the cephalic vein on the antebrachium. Your back muscles feel, or Heather will feel for the spines, or you can even see them, the dorsal spines of the vertebrae. The more medial back muscle that runs along, the more medial one is the multifidus. So it's more medial, multifidus, and the more lateral one would be the longissimus dorsi. So just to clarify, it's this one, not this one, or it's this one, not that one. Okay. Okay, so the hip abductors. So to clarify that, what we'll do is show you all three. So show you as a group, so all of a sudden you know what I won't do that, but they're, your more caudal one is the superficial gluteal, the medial gluteal, and both of those gluteals are closer to the spinal column, and the tensor fascia lata is this bigger one down here. Okay, so the tensor fascia lata is more ventral, middle gluteal, and superficial gluteal is the more caudal one. Okay, I forgot the adductors. So your superficial hip adductors, the sartorius is this one here that sits on top of the quadriceps group. Sartorius, they're all going to be detached at the knee, so we can get under that. And your gracilis, kind of beat up on this cat, but it's the more superficial one caudally. Okay, so the gracilis and the sartorius. Then deep to the gracilis, we pick it up to see the other hip adductors are the pectineus, which is the most cranial one. It's just a little guy, it's not huge. Although in some of the bigger cats, it might look bigger than in the little cats, but it's the most cranial one. Then you have your adductor muscle. And so those are your hip adductors. And then medially, the last two in that order are two of the hamstring group, the semimembranosus and the semitendinosus. So I'll do those again when we get there. Okay, but those hip adductors, they pull in there, whereas these attach more at the back, so they flex the shank there. Okay, your quadriceps group. Okay, there's three that are pinnable. So remember again, they're underneath the sartorius. You have your vastus medialis, your vastus lateralis on the lateral side. So that's what it looks like there, the vastus lateralis. Okay, this is one of the hamstrings, your biceps femoris. We'll get there. So vastus lateralis, vastus medialis, and in between those two is the rectus femoris. The vastus intermediatus is deep. The only way I'd do that is say, and this is what I forgot to do in the morning group, so if you could share this with them, that would be nice. So name this muscle, vastus medialis. To what group does it belong? Quadriceps. Okay. Same thing with the hamstrings. To what group do they belong? Is the hamstrings. So that's what I'm after to for that. And then name 3 other muscles in this group for the quads. So that's the only way you have to know vastus intermedius is a theoretical. Okay. Then, okay, so our hamstring group, again, your semitendinosus is at the back, and it's kind of a long strap-like looking muscle, semitendinosus, and then cranial to that is the semimembranosus. So semitendinosus, semimembranosus. The biceps femoris is visible laterally. It's this honkin' great big one. Okay, name this muscle biceps femoris. To what group does it belong? Hamstring group. Okay. Underneath the biceps femoris is the very huge sciatic nerve that you need to avoid when you're doing injections. And if you lift up the biceps femoris, you can again laterally see the semitendinosus and semimembranosus. So semitendinosus is always the most caudal, semimembranosus in front of it, okay, medially or laterally. The other thing that could be asked back here, any structure that's in a fat pad, name this structure behind the knee, would be the popliteal lymph node. I don't necessarily see it here, but the one this morning that I did had a really nice one. Name this structure, even if you can't. Fat is never an answer. Adipose tissue is not the answer. Okay? It'll be name this structure, and it will be the popliteal lymph node. Yes. Yeah, it's behind the knee most, but it'll be in that region. Yeah. Okay. The other muscle here is your gastrocnemius, and it's attached by the Achilles tendon. So name this structure. Achilles tendon attaches to what bone? The calcaneus. Conversely, I could put a sticker on the calcaneus bone on a skeleton and say what tendon attaches what muscle. Okay, so you have to know it both ways. Okay, gastrocnemius, Achilles tendon, calcaneus. Femoral artery and vein. Remember, arteries are red and veins are blue. So femoral artery and femoral vein. So make sure that you're saying, because the question is name this blood vessel, and femoral, we could pick this out. There's probably the arteries injected too. So femoral artery, or femoral vein, sorry, where the femur would be past the stifle, it's the saphenous. That's all you need to know there. That's it. How easy was that? Sorry.
It only took half an hour.
There you go.
Thank you. Oh my God.